Hello, Raleigh. Welcome to the Monday edition of Your Backyard with our weekly guest, Dr. Susan Lovelle. Hello, Dr. Lovelle.
Hello, Robert.
Very serious in Monday's broadcast because well, it's a
Right.
serious situation. Um, well, thank you for joining us again. You want to share some of the numbers, although I feel like we kind of know where they're going.
Yeah, I think we see across the nation the numbers are for the most part going up. There are a few states that are starting to turn back around again, more in the Northeast, believe it or not. But most of the states are on an upward trend, including North Carolina.
Um, Reviewing that John Hopkins map, it's just getting darker and darker and redder and redder. It's a little bit frustrating and depressing. Um, but wait, that's not all. We got a lot more news. Um, we were talking earlier that we're probably going to see a holiday spike. Do you agree with that, Dr. Lavelle?
Yes, in all likelihood. I mean, if you look at the photos of not so much the beaches, believe it or not, have been pretty good with keeping people spaced out. So for that part, I think that that's okay. But what has been seen are, the people who are coming into town, even from out of state to North Carolina, and going to say Glenwood South to go and hang out at the bars that are open, and they are packed.
Mm-hmm.
There are people standing right next to each other. There are no masks on, and it's just flying in the face of everything that we're being told to do right now.
Right.
Has to do right now.
Um, I'm no expert, but I can tell you that I firmly believe it is now impossible for drunk people to be social distanced. It's just it's just not in the capacity of our nature. We all get in each other's face. So um, very worried about that. Jonathan was sharing that even in the sports bubble, that they're still getting some diagnosis of COVID.
Right. So we're wondering, they're tested when they get there, and they're negative, and then they're tested while they're in there, and then all of a sudden there were some soccer players who were positive. So what was that all about? The fact that we still have, some of the workers, these workers are still allowed to come in and out. Did they catch it on the way in? Traveling in, don't really know. So
Right.
it's really just something we have to keep an eye on.
We do need to keep an eye on it. Any word on the vaccine? I've heard there's this and that, but even that's months, if not years away. Uh,
Most vaccines take at least a year,
okay,
even being expedited, because you've got to test and make sure. And the one thing you don't want is to throw a vaccine out quickly that's either not effective or that is even worse, it can do harm. So there's
right,
always a lot of testing. There are some things around dexamethasone, which is a steroid that's a very common steroid used in medicine that has been shown to have some decrease in mortality, not just in the length of stay, but in some mortality. So that's a whole
right. And as we mentioned before, mortality is only one part of it. Most people that catch it obviously don't pass from it. It's
right.
not that lethal, but there's so many after effects and lingering effects from just having it. Um, we also discussed a new trend. Not surprisingly, cases are rising most quickly on that age group of 18 to 35,
Yeah.
um, simply because they're more likely to feel invincible, I think.
Right.
Yeah.
And I totally understand they're bored out of their minds at this point, want to get back to being social, being with their friends and everything, and living life again. But that is why we're seeing those numbers spike in that age group. I think it might be in North Carolina, it's actually 60% of the new cases. And so you
Wow.
say, is it that we're testing more? Are we testing these people more? Let me just say, I don't think it's the fact that an 18-year-old asymptomatic person is running to go and get tested.
Right.
Not it. I really think that we're seeing these numbers actually start to spike
Because that's where it's spiking,
because
right? Yeah.
exactly, exactly.
You also mentioned, I think these are very much worth sharing with everybody, that along with some of the basic symptoms like the scratchy throat, we've talked about loss of taste. Um, Could you share some of the newer symptoms we're seeing now?
Yeah, yeah. So one of them, one of the groups is like upper respiratory. So congestion, runny nose. These are things that we may just kind of put to the outside allergies,
Yeah.
or something, but there's now being considered a new symptom. And then the other is GI, so nausea and also diarrhea. And something that I want to add is that they had been noticing previously, before this was actually put into the newest symptom cluster, that people were presenting, if they did present with a GI symptom like whatever, they were seeing it earlier and that it lasted longer. So
Okay.
that's another thing to keep in mind.
So what I find tricky in my hyperparanoid state is sometimes, I have a little runny nose. Oh, I got a little runny nose, and it goes away soon or shortly. Not a big thing to say. And we all have some of these from time to time. But if we're seeing two or three, or at what point, any one or two of them last a day or two? Is there a point where now my tension resolves, because none of them last more than a day? But if I have two or three for a day, maybe I should be tested? Or can you give us some direction about how to look for and manage these symptoms as a course of action?
Yeah, that's the $1,000,000 question at this point. The symptoms are they're now becoming so all encompassing. The question is, do you get tested for every single symptom? Do you wait it? Do you just ignore it altogether? And so, the answer really is if you're not really ill, then continue to social distance, continue to protect others from yourself. If the symptoms continue and start to get worse, then yes, I would say go in and get tested. But we all can't do that at this particular point.
Right. Well, let's talk about the testing. So there's two, right? There's the active virus testing, which you can do at any CVS or many of the drugstores. You set an appointment, you drive through. And that's checking for active virus. Is that correct?
Right. And then the body, which
Right.
there are some pros and cons to that, and there are some who believe that they're not as accurate a test. And so really they're going more towards the active virus. Within that, though, you can do both nasal, which is
Right.
the thing way back there.
That's what I did.
You kind of scrape your brain,
Yeah.
or you can do stool. You can actually find the virus in stool. So those are the two big ones that are available at this point.
And if it's the active virus test, I like to think of it as an X-ray. It's a point in time, right? You can't say I was tested 2 weeks ago. Well, you were good last two Mondays ago.
Exactly. And that's the other issue. You could get tested today, walk down the street and get it. So it's all a matter of the best thing, is prevention and just the precautions that we all know very, very well at this point.
Right. And Dr. Lovelle is encouraging all of us to double down on precautions. If just because so many aren't, don't get lazy. Keep your focus on.
Exactly.
So I heard this argument the other day, and it really stuck with me as stupid. And I'm sorry if you're listening who made it to me, but I had someone say they refused to wear a mask because they were working on building herd immunity and that they were doing me a favor. And I'm like, well, that's ridiculous. And so define herd immunity, please, Dr. Lovelle, and explain why that is not a quick fix in any way, shape, or form.
Exactly. So herd immunity is when a certain percentage of the wide community has not only developed the disease, but has overcome it and now has antibodies. And so you've got enough people that you're not going to continue to see that spiraling upward, that exponential. Right. And with any illness, we eventually have that kind of thing, or we be responding to everything. It eventually gets there, but it's not something that happens in a week or 2 weeks or even a couple of months. It's something that takes a while. And while that's happening, if you have a lot of people who are going out exposing themselves and exposing others, like we hear about these COVID parties,
Right.
you run the risk of again putting ourselves into that spike and injuring others and harming others while we're trying to get to that point.
Right. And then if that were simply our take on it, hey, let's just all get herd immunity, our hospitals are going to be overrun, our healthcare system is just going to be tsunamied into being flattened, and then we're all broken. And then if you just have a toothache or any other ailment, you're not going to be able to get medical care. So,
Exactly.
so you know, I'm sorry.
Yeah, I was gonna say we've already gotten to that point where, unless it's something really serious, the hospital is not the place to go right now.
Right. Um, so John Hopkins does a great job of tracking the infections. Is there some way we can check how our hospitals are doing? Really and truly, that's what we're trying to prevent. Is anyone that you know of, Dr. Lovelle, tracking the state of our healthcare system?
Usually the state will do that. The medical board may also be able to give those kind of numbers. But if we look at each particular hospital where we are, we can actually go to their sites and find out.
Okay. I'll try to do a little research for next time, because I just don't, it's just obvious some people are not going to take the simple precaution to help everybody out. Any last words, Dr. Lovelle?
Well, I mean, I think the thing is that we all know. Well, let's put it this way: we all should know what to do at this point. The main thing is to think of it not so much as making these changes, wearing a mask, washing your hands, saying social distancing for yourself, but think of it more as doing it for others. And I was thinking the other day about when we had World War II, after World War II, or during it, how much our entire community put themselves, sacrifice essentially themselves for the good of everyone else. Whereas now there's a huge part of our wider community who is in it for them, just for themselves.
Right.
It's for me, and I have a right. And so, I don't want to get too harsh, but maybe we need to start thinking the way we used to think a couple of generations ago about doing what's best for everyone else, not necessarily only for me.
Right. So, Raleigh, do take care of yourself. Do spend a little time and do the right thing to take care of each other. And if you see somebody wearing a mask, I was out the other day at my coffee house, and I just very politely said, if y'all don't mind wearing a mask, I'm very sensitive to COVID. And they didn't even have a mask. I kind of called them out on it, but they did back up. And it was kind of this moment where, just politely do, so if you maybe need to push, but do stay home, wear your mask, wash your hands. And if you need Dr. Lovelle, she is awesome and stands ready. And Dr. Lovelle, thank you for joining us today.
Thank you so much.
Raleigh, all this and more is right here in your backyard. Join us next week for another update. And until then, cover your mouth. Bye, Raleigh. Thank you, Lovelle.